Welcome to Jacked and Cracked, the podcast where chiropractic care, fitness, and real-life stories come together. Get insights, practical tips, and everything you need to move better and live stronger.
Welcome back to the Jacked and Cracked podcast with your host, Zebulon Thomas, and Dr. Max.
Hi, guys.
Today, we're going to be talking about chiropractic care, the safety of chiropractic care, and who can get adjusted. Dr. Max, can you open that up for us?
Yeah. So the first part we'll talk about is the safety of chiropractic care. So I would tell listeners that at least 50% of the new patients that come to my office, probably more than that, have some sort of health concern or fear of risk when it comes to chiropractic, getting adjusted, what it's going to feel like, what it's going to be like. Am I going to be worse afterwards before I get better? Am I just going to be worse afterwards? They might be coming to my office because their neighbors or the family or friends have referred them and put a lot of trust in me, but they still have a hesitancy. Maybe they knew someone who had a bad experience, or maybe they just have watched it on social media, or maybe in like 2.5 Men, where the one character's a chiropractor, and it looks scary. So some common concerns that come into my office, and these are hard hitters. Common concerns, people say, hey, if it's just the more like loose grabbing at something that looks like you could do, like, hey, am I going to be paralyzed after this? Has that ever happened? Are you going to break my bones? And then on a more scientific level related to the, maybe someone who's been tied to healthcare before, could I have a stroke with chiropractic care? So we'll start with the paralyzed thing. It's funny. We joke about it in chiropractic that people think we're like trained assassins because we adjust the neck. So they assume like, oh, and if you just go a little bit further, the person dies.
Yeah, and we've had that conversation too. I've actually had that concern. So I'm one of them, and you work me through it.
Right. And it's really, that's not how chiropractic school goes. You go through pretty much 1.5 years where they don't even let you adjust anybody. You just what we call set up on the adjustment. They explain what you're going to do, but you get graded just on getting into all of the right positions before the adjustment. And that helps get you to a point of confidence where by the time you're allowed to adjust, you are very confident that an adjustment is going to take place. So you start to get to a spot where you're like, oh, I know if I just give this the little bump, it's going to go.
Oh, yeah.
And it's one of the big things when it comes to, let's say, our neck adjustments, is that, because that's the one that spooks people, is that we aren't actually twisting the neck like you see in a lot, an action movie, they get up behind the guy and they
take out the assassin. Yeah.
We don't do that. Actually, an appropriately delivered chiropractic adjustment, and there are a lot of different ways to adjust the neck, but the one we're talking about is the one people are thinking of. You actually don't twist the neck. When you have the patient's head in your hands or neck in your hands, you bring it over and you bring the patient's neck into a bit of rotation, and then you actually do this. So you're actually moving up.
Okay.
So the adjustment, to use my own neck as a reference, is this way, not this way. So you're not turning the head over, you're doing this with it, if it's appropriately delivered. Yeah. So if you're giving adjustments the way they should be done, there shouldn't really be a ton of rotation in it. The person's nose shouldn't end up facing to their left or to their right. Their nose should actually, as they get brought into adjustment, their nose should move up like this. So we're not actually spinning anything around when we do those adjustments. People are concerned about the cracks and the pops. And those noises are actually just, we call them cavitations, which ties more to what you hear in underwater terminology, because it's actually bubbles popping. It's bubbles popping in the fluid around your joints.
And that's why you feel that relief, that euphoria.
Yeah. And that bubble is created, it's nitrogen is what it's made out of, and you get nitrogen in your body from protein you eat. So it's kind of like making a clap.
Okay.
So a clap, the noise made by a clap isn't because you smack your hands together really hard, right? Because if you've ever like smacked a thigh or something like that, it makes a very different noise than when you clap your hands together. To make a really loud clap, you pocket your hand, and when you bring your hands together, you're breaking that air pocket, which creates that sound. It's the same idea with the adjustment. That's what's actually happening with the clicks and pops. So it's not actually your bone snapping when you hear that noise.
Yeah.
So that kind of disarms that concept.
Yeah, it takes the fear and the anxiety out of that, knowing that it's not a bone. Actually, it's not bone on bone per se. It's just bubbles.
Yeah, it's just bubbles. And some people don't crack a lot, actually. Some people, maybe they don't have a lot of nitrogen in their body because they don't eat a lot of protein, so you don't hear a whole lot of clicks and pops. And then other people might unload and sound like a glow stick when you adjust them. So
just
it's
light up, right?
Yeah, exactly. So that's what's going on with that sound. Now, on extremely rare occasion, people can, when you're doing mid-back adjustments a certain way, there is a small risk of rib fracture. It's super uncommon, and usually if a patient is going to be prone to rib fracture in their health history, you're going to know they have osteoporosis, osteopenia, something like that, and you're going to adjust them a little differently. There are different ways to adjust so that you can really try to avoid that taking place. It's not something that's very common at all.
But that's also why you go through the screening and the process, and you stay with the right chiropractor, so that over time, they know you're right.
That's why it's important to go to a chiropractor who does, a good first visit exam, and then maybe does re-exams throughout your time as a patient too, so that they're going to know those things. If you go into an office and the chiropractor, or let's say even different than that, let's say a chiropractic assistant comes in, gives you maybe a 3-minute sit down, and then you're getting adjusted after that, that might be of concern. The exception to that being if you're at, let's say, a 5K, and you've been a patient of a chiropractor before, and you go to a 5K, you're going to run the 5K, there's a chiropractor there, they're adjusting as part of the event. You've already experienced chiropractic, you walk over to them, you want to get adjusted, that's great. That's fine. That's a different scenario. But if you are going into a chiropractic office for a visit to relieve symptoms, and the examination, it takes, less time than brushing your teeth. You should be concerned, because there's a lot of questions that need to be asked about your health history to make sure that you get the appropriate adjustment. The next part, so we talked, about the am I going to get paralyzed? No. Is it my bones breaking or cracking? No, that's not the sound. Like I said, in extremely rare occasion, you can get a rib fracture. Like I said, it's very, very rare. And then the third one we said, stroke, which is a more scientific one. That one I'll hear not as often from the average patient, but I will say the number one patient demographic, professionally speaking, in my office is nurses. And number 2 is fire paramedic. So actually, other healthcare providers make up my top 2 professional demographics.
So they're the ones that have the concern.
And they might have a more scientific or medical concern, and they'll talk about stroke. Strokes typically happen when you have these vertebral arteries that go from, they run down your neck or up your neck, and then they go to the brain, and they supply the brain with blood. So the fear is that when you adjust someone and you do that neck adjustment, it's going to sever that vertebral artery, and then they're going to lose blood flow to the brain. That is another one that is so extremely unlikely that with research, they found that actually getting your hair shampooed at a salon or a barber shop where you lay your head back in the basin, you're more likely to have a stroke there.
And also is that I think it would take a lot to sever per se, but you have
to do it wrong. Yeah, you have to do it wrong. You have to not do the adjustment the way we're taught in school. You have to turn the person's neck real hard.
Yeah.
You have to have not done an appropriate screening as the chiropractor to know that the person was predisposed to a stroke in the first place. Maybe they've had one in the past.
That's right.
And you take them through a physical exam to see if their vertebral artery is compromised. Because for the average patient, these neck adjustments are completely safe for the vast majority of people, completely safe. But every now and then you're going to get a patient where you move their neck into the position to go to adjust them, and they're going to get real dizzy, wobbly, lightheaded, feel uncomfortable. And that should be pinging all of your red flags as a chiropractor. But, hey, I shouldn't adjust them like this. And it doesn't mean you can't adjust them. Doesn't mean those people can never get neck adjustments. You just don't do it that way. You do it a different way, like traction adjusting or something like that. You might use an instrument to adjust them.
That's right. And I've had those to the clicker.
Yep. So there are different ways to adjust those patients. I believe 2 times in my career now, and I'm coming up on, let's see here, I'm coming up on 14 years in practice. 2 times in my career, I've had patients come in the office where all of the buzzwords they were feeding me and the phrases they were using to describe their symptoms that day screamed, I'm about to have a stroke. And they teach you about this stuff in school too.
Yeah, absolutely.
They teach you about all the stuff you're supposed to be paying attention to pick up on that stuff, and the orthopedic tests you're supposed to take them through to see if they're prone to this or potentially having it. And one time the person wasn't having a stroke, but we still sent them over to urgent care ER to just make sure. And the other time the person was pre-stroke. I had not adjusted them yet. The painful part about that was we sent the patient to the emergency room, and the ER doc blamed chiropractic adjustments for the stroke, but I didn't adjust them.
Didn't adjust.
So they had not been treated. They were not adjusted. And he just pinned it on like, you went to the chiropractor. So the chiropractic adjustment caused.
So then that person's like, I'll never do chiropractic care again.
Well, here's the funny thing. The patient actually, because of their connection to my facility, was like, it actually lost credibility for the doctor then in the ER, not me, because it was like, you just pinned that on the chiropractor. He sent me here. He's the one that detected that I was about to have that. And 2, he didn't adjust me. So you just blamed him for something he didn't even do without listening to the entire story.
It was more concerned about the blame than the solution and the problem.
Right. So, and the truth is they call the main cause of most strokes is what they refer to in the healthcare world as idiopathic, meaning we don't know why the average person has one. Idiopathic, kind of like the word idiot, not knowing. So we just made it fancy sounding with idiopathic. So that's my personal experience to it. No one's ever had a stroke in my office, on the table, nothing like that. We adjust, in our office about 500 to 600 patients a week.
Yeah.
There's 3 doctors in the office, myself and 2 others, Dr. Stephanie and Dr. Matt. We've never known that. If someone's like, oh, I knew somebody who had a stroke from a chiropractic adjustment, either one, chiropractor really didn't do their due diligence or maybe adjusted them wrong, but really that's less common.
Or where the facts are, right?
Right. It's because we've heard it before, because I get a lot of nurses in here. Hey, if someone's going to have a stroke from a chiropractic adjustment, it's going to happen in that moment. You adjust them, you sever the artery.
Yeah.
They have stroke on your table.
It's not a later on thing.
It's not like, and then 2 weeks later I had a stroke. Yeah. It's so unlikely for something. It's already unlikely to happen. Yeah. And then it's so unlikely that an adjustment 2 weeks ago could have this delayed effect that that's not how it works. If you're going to tie something like that, like a stroke episode, to my adjustment, you're going to say that this adjustment we're going to refer to as a trauma. This trauma caused this stroke. It would happen immediately, right? Yeah. It's not like this. And then I walked around for 2 weeks, living my life, doing things. And then, or let's say 2 months or 3 months or something like that. So it doesn't work like that. That's not how that physiology works. Again, it's never happened in our office, and if done appropriately and your chiropractors are screening and listening to you when you come in on your visits and not just plopping you on the table and blasting you. You walk in the room, every single patient gets a, how you feeling, right? Even when your family comes in, right, Zeb?
Yeah, absolutely.
Each patient I go through, even though I'm talking to you and I might be BSing about life and everything else, every time one of you lays on the table, when you come in, your family of 3, 4, or 5.
Yeah.
I ask each one of you, hey, how are you feeling today? So there's still that moment so that the patient can tell me what's going on, so that if there were any red flags or yellow flags, they would pop for me when I ask questions. The other thing too is, as I mentioned, when you set up on a neck adjustment, if someone was going to be in that pre-stroke state, just from, again, idiopathic, could be anything.
Yeah.
You would set up on the adjustment, and before you deliver it, you would see the response from the patient getting loopy, dizzy. They get this thing going on with their eyes where they flutter. The eyeball itself. You would pick up on those things if you were paying attention, which you should be doing, and it just won't happen. So,
yeah, and I know that, like, for instance, I see you a lot. I come to you with my family, and we get adjusted. And I always encourage my brother, you need to get adjustment. You know, he do hard labor. You know, his back's always whack. And his excuse is like, yeah, but I'm going to be, I'm actually okay now. You're not okay. You're complaining. He's like, yeah, but I'm going to be worse if I get adjustment, and I don't have time to keep coming back and fixing that. Now, I kind of understand what he's saying, because there's been times when I had an injury. Now I have an injury, right? And the injury adjustment is, we adjust it, and then I got to come back because it slips out or something, whatever the term may be.
Yeah.
And I'm like, oh, and then we keep correcting until it stays, right? Because I had an injury. But without having injury, and I come and see you, I just feel better. And then I feel when I'm out of alignment, I'm just not, my body's not firing on all its cylinders. And I'm like, I need an adjustment, right? And it's preventative maintenance at that point.
Yeah.
So I do understand what he's saying, where, I'll be sore, but I feel like him and a lot of other people that feel like, if I go get adjustment, I'm going to actually feel worse. Like, you might, but you're going to feel better long term. And if you don't have an injury, you're going to feel great.
Yeah. And could you imagine going to, let's put it in a similar arena, but different one. Could you imagine going to an orthopedic surgeon and getting a spine surgery and saying, hey, but doc, immediately after the surgery, I'm just going to feel better, right? They're like, no, you're not even going to be able to get out of a chair at first. Actually, you're going to definitely feel worse before you get better.
Yeah.
So it's funny, in other arenas, when it comes to physical medicine, it'd be normal to feel worse before you get better. Even if we want to take it into another physical arena entirely with a workout, right? How do you know what's the best way to know that most people think of, the best way to know you had a good workout? You're sore afterwards, right?
Yes, you're waking up sore. It's a good sore, though.
That was like, good. Okay, that workout counted. That's nice. So when we first start care, a little bit of soreness, though I never want people to hurt, a little bit of soreness isn't the worst thing in the world. It actually tells us we did something. If you don't feel any different, that's the true concern for me as a chiropractor. So if I adjust you, and I adjust you a couple times, and you have felt no change at all, you don't feel better, you don't feel worse, but you don't feel better either, that's actually more concerning than the patient that was a little sore after my first adjustment. Because if the patient didn't feel anything, that means I may not be having any impact on what I'm trying to treat.
That's right. And as far as age goes, you've adjusted. Well, we were talking about, who can get adjusted. I personally have brought my little baby to you right when she was born, so she's been seeing you since she was born, and she's now 11. Right. Yep. So, babies. Yeah. And so let's talk about the age and who can get adjusted.
Who can get adjusted. And it's from the minute you hit the earth to the minute you go into it. So, and hopefully getting adjusted makes that span much, much longer. But the truth is, chiropractic is a very, very safe healthcare if performed properly and the patients are examined appropriately. So we adjust newborn babies. We've had moms come straight from the hospital, and before they even stop home, they get adjusted because of what they just went through having their baby.
Yeah.
And they get the baby adjusted because the most traumatic thing we will ever survive is childbirth. It's the whole reason that our skeletal structure isn't fully developed when we're born. So it's because of that. So really, we're kind of moving cartilaginous bones.
Oh wow! Because it's squishing. It's
wow. It's a different material at that point in time. Your bones haven't what we call ossified, turned into bone material. Truly. Yeah. So you have almost like a cartilage skeleton at first, with these little bone islands, and but you still can move those. And the thing about adjusting a newborn is it's this very gentle process. You've seen it done, but I always explain to people when I'm adjusting a baby all the way up to about 2, really, it just looks like I hold your kid funny. Is the way I explain it. Yes, I hold them right. I'm using thumbs. I'm using my fingertips to adjust them. They don't have the muscular structure to resist the adjustment as much.
Ladies and gentlemen, that's how he adjusts me still. He still picks me up and he squeezes.
Hold them and just put them on my lap. It's almost going to be okay. Yeah. So, no, but it's And each chiropractor has a different way of adjusting kids. I tend to hold them. If they have stranger danger, I will have the parent hold the child,
Oh, yeah.
actually. I adjust them through that. A lot of times the parent can become the table. So we have the parent lay down on the table, and then the child goes tummy
And
to
I've
tummy
seen
with
that.
their parent.
Yeah.
And I adjust the kid that way. So if the kid's a little nervous or having a tough day, it's like that.
I feel like
If
that
they're
way
not-
is really, it's a really therapeutic and nice way to do it that way you just said, because like it's bonding the child with the mom and the trust with the chiropractor. I feel like that's a really good lead into. Mm-hmm.
Yeah. And babies don't snap and pop like we do. So the cool thing for the parent is that when you put them on you and I adjust them, you can feel it. You can feel me adjusting them. So it's really cool.
That's awesome.
So we have that, and then and you would adjust the baby for wellness. You'd also adjust babies for things like colic and gas, constipation, torticollis, where their neck gets cocked to one side. So a lot of babies have one side they prefer to feed on versus another. When they're laying for tummy time, they could to one side versus the other. So creating balance there is very helpful for them and their healthy nervous system development, developing their entire body. And then going all the way to the far stretch of the other side of the coin, some people are afraid, my mom, my grandma, she's got osteoporosis, so she can't get adjusted, or she's had a hip replacement, or she's already had a spinal surgery, so she can't get adjusted. That's not true at all. We can still adjust those patients. It just changes the way we approach it. Here we use digital x-ray, so we know exactly what we're looking at and what we're treating, when we go to treat it. And you just shift gears. So sometimes people look at a guy like me and go like, I don't know if I want that guy to adjust me, he's going to tear me in half. It's really not true, right?
Right.
We shift gears. Not everybody gets the same amplitude of adjustment. And I actually tell people athletic individuals tend to have more control over their body. So if you go into a chiropractor and they look physically fit, chances are they actually have more fine-tuning control over what they're about to do for the adjustment than an untrained individual, because again, through training, you learn how, and especially if you played sports, you learn how to give variable degrees of force for whatever you're about to do. For example, I played baseball, right?
Mm-hmm.
So if I'm playing second base, that throw to first base looks a lot different than when I'm playing center field and I'm throwing it into home.
Oh, yeah.
As a baseball player, you learn how to vary up your approach to each task at hand. And so chiropractic is no different. You're just changing the amount of force. Really, it's the speed that you provide to each adjustment. Sometimes how much body weight I'm going to use, how much my own body weight.
Oh, yeah, to get the adjustment.
Yeah, so like when I'm adjusting your daughter, for example, I don't use any of my own body weight. I actually completely remove that from the equation and just adjust her using my hands and arms.
Oh, yeah.
Where when I go to adjust you, there's a little bit of body weight included.
Yeah, you jump off I saw you
the top rope.
You run and then you jump.
Do the karate thing.
And I was like, no.
Right. So the truth is, in people who have had surgeries, that's another one. I've had a spinal fusion, so I can't do it. That's not true. We can adjust the areas around that. We take an x-ray, we see where the fusion is. We're not going to move the fusion. Yeah. And if you've ever had one of those, the screws they put in you look like giant, long drywall screws. I'm not breaking those with my adjustment. I couldn't break them. I couldn't break them with my bare hands. Yeah. I mean, if you gave me a drywall screw and said, "Here, snap this," like nothing's happening. So it's not going to break when I adjust you either. Really, we can adjust people that fall into every single category. We just change the way we adjust them. So the only times I've run into situations where I can't adjust a patient is actually when they have a form of physical phobia, maybe some sort of trauma they've experienced in the past where just like physical touch is not on the table.
Yeah.
And if that happens, it's unfortunate, but there's not a whole lot we can do if we can't treat you. You gotta let us go in there and not go to the chiropractor and asking to not be adjusted, or maybe they are asking to be adjusted, but when you go to adjust them, it just triggers emotional response that's just not allowing us to actually help them. You're causing maybe physical relief, but you're creating an emotional or mental stress. It's pretty much the only person the only category of people I can think of that would be off the table. But
well, that's awesome. I will say, so if you are listening to this or watching us and you'd like to learn more about chiropractic care, definitely check out the Healthiest You Chiropractic Center in Strongsville. And you can also find a link on the Jacked and Cracked website, jackedandcracked.com. A link is below. And you can learn all about Dr. Max and the Healthiest You and his wonderful staff and other chiropractors. You have more chiropractors too. So
yeah, you got it. You got
absolutely. Well, thank you so much for filling that in and letting us know that, we don't have to be afraid to go get adjusted, and we get adjusted at any age, and you're not going to take our neck off.
Nope, not at all.
Not going to break it. Awesome.
You got it. Well, thank you so much, guys. Thanks for joining us.
Thanks for tuning in to Jacked and Cracked. If you enjoyed today's episode, don't forget to subscribe and leave us a review. Stay aligned, stay strong, and we'll see you next time.